We want to end this section on fear with a discussion of red flags. Because up until this point, you might think, well, okay, I've got pain. I just have to have a better mindset, not allow fear to drive me, and I got to make my brain feel safe. Uh, while that is true, there are sometimes serious medical issues that could be driving your neuromusculoskeletal pain. So before you start to engage with the pain, treat the pain, quote unquote, we want to make sure that a serious medical situation isn't driving the pain. And what are those broad categories of the serious medical issue? Well, it's first one would be a fracture. If you have a fractured bone, you generally don't want to go to therapy before having it looked at by a physician because we want to make sure that that bone heals. And so a fracture is a red flag, a serious medical situation that would need to be cared for. Infection. Is your pain being driven by infection? If that's the case, well, you need to treat the infection, um, having that cared for medically. Could your pain be stemming from cancer? That's always a scary thought, and it's a serious situation. Um, Generally, our neuromusculoskeletal pain isn't, but we have to clear that. And one of the biggest indicators that your pain may be cancer pain is if you had a history of cancer. If you don't have a history of cancer, it's most likely that your pain has nothing to do with cancer. But again, that's what a healthcare provider, whether it's your primary care provider, a specialist, even a physical therapist, if we're your first point of contact for your pain, we want to do a screening to make sure that it's appropriate for us to engage with this pain, making sure it's not a serious medical issue. Another red flag that we always want to look out for is the spinal cord being compressed? Again, not a common situation, but and there will be signs to look for. In particular, again, rare, but we want to screen to make sure that none of these serious medical conditions are happening. And in general, when we think of neuromusculoskeletal pain, your typical aches and pains, in your joints, in your muscles, tendons, ligaments, we call this mechanical pain, meaning it's this pain changes with our position, our posture, the activity we're doing, the time of day even. So with these pains, musculoskeletal pains, there are aggravating factors and easing factors. See, with a fracture, with an infection, with cancer, with spinal cord compression, it's a truly constant pain. You know, sometimes if you have back pain, you always have back pain, but it varies in its intensity. With the red flags, fracture, infection, cancer, spinal cord compression, there's no variety. It is truly constant and it's not changing. There's no aggravating and easing factors. It's constantly there. And just going a little more specifically into some of these red flags, how might you know, or what are we looking for to see, is it a fracture that's causing your pain? Well, we want to see, did you just have a physical trauma? Did you just fall off a ladder? Did something hit you very strongly? Might you have a history of osteoporosis? Do you have a history of chronic steroid use? More than 4 weeks out of the year of using steroids leads us vulnerable to having fractures. And a sign of a fracture, especially if part of the bone is close to the surface of the skin, if you were to tap it gently, it would be an excruciatingly painful feeling. And of course, imaging would be appropriate there. Signs that you might have an infection: a fever, having more than a 98.6 degrees Fahrenheit temperature, but your blood pressure will often be elevated, as might your resting heart rate, your pulse. When wondering if cancer is driving your pain, the biggest potential indicator is, do you already have a history of cancer? But might you have unexplained weight loss recently? That could be a possible indication to get this checked out to make sure there's no cancer. And is the pain truly, truly constant and unvarying there? And when it comes to spinal cord compression, there's a a situation called cauda equina syndrome. That comes to the refers to the low back area, the lumbar region there, where aspects of what's called the cauda equina, which is below the spinal cord, a bunch of nerves, if they're getting compressed, one would have onset of a loss of bowel and bladder control. You may not have any sensation in the saddle region, the perianal region over there. If your spinal cord is being compressed, your reflexes may all of a sudden become hyper reflexive. You may have some muscle wasting. Those are all signs that will indicate that further evaluation is needed. So if we have these red flags, we may hold off on any kind of therapeutic intervention until a serious medical issue has been ruled out. And if it is a serious medical issue, of course, we want to take care of it. So in our next section, we're going to dive into the three drivers or the three types of neuromusculoskeletal pain.